Good morning, Uthman and Susan, and welcome to Hometown Living.
Good morning. Thank you.
So we're going to talk about something very important, and that's something that I think a lot of women don't like to talk about, and that's endometriosis. So what are some of the symptoms of endometriosis?
So first of all, endometriosis is a condition in which uterine tissue grows outside the uterine cavity. And when that tissue is outside the uterus, it causes a lot of pain and inflammation.
And so what are the symptoms that, like if I was suffering with endometriosis, like what symptoms would I be experiencing?
Well, you can imagine that wherever that tissue decides to implant and it bleeds in synchrony with your period every month, you're going to have pain and inflammation wherever it decided to land. So the symptoms can be varied.
Yeah, so common symptoms are pelvic pain, low back pain, pelvic pressure, vaginal pain, vaginal pressure, abdominal bloating, abdominal cramping, labor-like cramping, like when a woman's in labor. A lot of people will have symptoms that are consistent with like a bladder infection or even irritable bowel symptoms. So their pain is the primary symptom, but even things like infertility are common with endometriosis, recurrent miscarriages, ectopic pregnancies. And pain with intercourse is just a huge one for some of our patients.
How long do I let those symptoms go on before I reach out to a doctor? Because I'm really good at like saying, oh, I'm sure it's nothing. Oh, it'll be better. Oh, I'm sure I'm not the only one that does that. So how long before I reach out?
So anything that's going on beyond 6 months is pretty unreasonable. Okay. So if you're having symptoms that persist beyond 6 months, I mean, I would say even sooner than that, but 6 months, you need to go in and get evaluated.
And so what makes your evaluation and your treatment different than most doctors?
Well, for the majority of OBGYNs, they're going to rely on surgery to make a diagnosis. But with our practice, a thorough history and physical will identify the majority of people who have endometriosis. So old-fashioned laying hands on patients and talking to them brings us to diagnosis in most cases.
And so what does an appointment look like? We just come in and we talk and you ask a series of questions, or what does that look like?
It's usually our first appointment it's clothes on.
That's always helpful. Not so nervous then.
And just a long conversation. I mean, the most important thing about making a diagnosis is the history. And you have to be thorough. You have to take the time to take the history. So it's not just personal history, but family history. So the history is huge. And then the physical exam is really targeted towards picking up endometriosis, but also other causes of pain and fertility issues.
And so you guys have like a virtual Q&A coming up where anybody can hop on and just ask some questions that maybe they have. Tell me about that.
Well, you know, one of the unique approaches we have is we don't just address medical and surgical treatments, we address your lifestyle. Because while things run in families, you can actually alter your medical situation, your symptoms, by the lifestyle choices you make. So we'll really address stress, nutrition is a big part, nutritional supplements, sleep, and really group support. So we find that if you don't address these lifestyle factors, even if you've had an excellent surgeon do a good job, it'll tend to recur. So some women don't want surgery, and so we use all of those tools to help to try to prevent that. Other women want it because they feel so miserable and they feel so much better, but they don't want the symptoms to come back, and that can make a huge difference.
I love that you talk about lifestyle, because I think that that's it, right? It's just there are things that we have in our control, but what I love about what you do is you give guidance to kind of, I don't know where to start. So I think that's wonderful. So as far as like treating the holistic, that comes along with the visit that you do, like you assess where I'm at, correct? And then tell me where I can make the changes?
Yes. It's not quick. It's kind of a long process. It's a journey together, and it's individualized because everybody has a different story, a different situation, and we kind of meet you where you are and talk about different options, and you know, you have a lot of stake in that. So like I said, some women just like, I want this pain gone. I want surgery. Other women are like, what can I do? And there's a lot you can do with nutrition and especially stress management, because he will often see people who improve but plateau, or just a really stubborn case. And a lot of time it boils down to stress, which is attributed to
Oh, a lot of things, relationships, work, past traumas. You know, we have to get into the details of people's lives. When stress is that huge a component, you're getting into the details of people's lives.
Yes, and in this situation in particular, 1 in 10 women have endometriosis, but it takes usually 8 to 10 years before a diagnosis is even established.
Wow.
A lot of times they're seeing multiple doctors because the symptoms, there's a wide variety of symptoms depending on where it lands.
Yes.
And so it can be very confusing, and often people don't have a diagnosis. And if you don't get to the root cause and treat that root cause, you'll have a hard time feeling better.
Yes. Wonderful. Well, thank you so much. You made that easy to understand and not so scary. So I appreciate that. So thank you for being here.
So we have that Q&A
Yes.
coming next Tuesday evening, the 18th of March at 6:15 p.m. It's virtual. You can register at caringforthewholeyou.com/endo.
Awesome. Great. Thank you so much for being here.
Thank you.
If you would like to learn more about Physicians Holistic Health Alliance, just go to caringforthewholeyou.com. Promotional consideration furnished by